Alrighty, so I just got done talking about about hyperthyroidism. Now I'm going to keep going, basically, and talk about nursing management of the client with hyperthyroidism. So I'm going to share my screen. Like I said, people with hyperthyroidism are going through about 4,000 or 5,000 calories a day. They get first breakfast, second breakfast, 11Zs plus 3 other meals, and they should be having high protein, high carb, low fat. Well, considering they have like 5,000 calories a day, reasonably low fat. And dietitian will help them figure that out immensely. So for nursing management of these people, we will be doing an assessment, of course. They will be, they may come in with these signs and symptoms: murmurs, dysrhythmias, hypertension, bruit, tachypnea, so increased breath, increased breath rate, increased heart rate, hyperreflexia, fine tremors. Like they will just sit there and they could like just literally like shake. Like all of their muscles are going through calories so fast that they just are like shaking. You need to be aware that when you've got endocrine problems, whether it be hyperthyroidism, hypothyroidism, a variety of other things, these endocrine problems take a long time to ramp up and they take a long time to decrease, except for like if we're doing a thyroidectomy. That's going to be an instantaneous sort of solution, but it's extremely severe. So we try and avoid it. But this is what you'll see from people. You'll see an enlarged heart because that heart's just working so hard. You will find some muscle wasting, like legit, their bodies are needing so many calories that they will use all of their fat stores and then they will go after their muscles. For nursing diagnoses, people will have activity intolerance, and you're just thinking like, why would they have activity intolerance? Because legit, their entire metabolism is being like all of their energy is being used to just exist. They're burning through 4,000 to 5,000 calories a day watching Netflix, let alone going up a flight of stairs or walking down the sidewalk or whatever sort of activity would be, taking a shower, what other sort of activities for activities of daily living. Their baseline metabolism, instead of being 1,200 to 2,000 calories, their baseline metabolism is requiring 4,000 to 5,000 calories just to exist. There is no extra energy to do any sort of activity. Because of this, there will also be impaired nutritional status, and because of they may have a lack of knowledge about how is it that I'm supposed to be able to keep my calorie goals up, and I'm supposed to stay low fat. Like my mom really likes chocolate. When she was having hyperthyroidism problems, she was legitimately eating 4 Snickers bars a day, plus whatever it is that she decided to eat around the house too, and she was still losing 5 pounds a week. So we will need to give them knowledge about really good nutrition. Overall goals for people with this problem is relief of symptoms, no serious complications related to the disease or the treatment. So we want to make sure that these people are getting treatment before they lose their heart or before they have a seizure that creates maybe an anoxic brain injury. We need to work with them to maintain nutritional balance, and they need to have a therapeutic plan that they can cooperate with. So implementation, we're going to be doing med administration to black thyroid hormone and the sympathetic nerve system. I talked about that in the previous video. We're going to be monitoring their heart, their oxygenation, their fluids, and their lights, making sure they get plenty of rest. That exophthalmos picture that I had shown with a gal with the really bulging eyes, they might have so big of a bulge in their eyes that they can't close their eyelids effectively over their entire eye. So we may be having them getting them help with eye drops. They may have glasses, like they would be wearing their sunglasses at night. They may be raising the head of the bed so that they can release some of that pressure. If they're laying flat, they're going to have a lot of intraocular pressure just because of the position they are in the world. And we may have to gently tape their eyelids closed for sleep, because otherwise their eyelids won't stay closed over those super bulgy eyes. We also may need to do some preoperative prep and some postoperative prep. So for implementation, with those preps, we're going to start discharge teaching. If they're going to have surgery, we're going to start discharge teaching. We can teach them how to monitor their hormone balance, how often they're going to be coming into the lab to get their labs drawn. We can work with them on when to decrease their calorie intake. We can I'll work with them about how to have adequate but not excessive intake of iodine, the importance of regular exercise. So this is discharge teaching after surgery. So they don't have a thyroid anymore. So they've been living with this hyperthyroid situation for a really long time. And this is the discharge teaching after we've done the thyroidectomy. The importance of regular exercise, avoiding high environmental temperatures, the regular follow-up care, and then signs and symptoms of hypothyroidism. And if they've had their thyroid out, they're going to need to be on Synthroid. And then we're going to be evaluating those as well. So the evaluation phase comes as, have they had their symptoms relieved? Have they had complications? Are they able to cooperate with the therapeutic plan? And are they able to maintain nutritional balance? So I'm going to stop sharing here. That's hyperthyroidism in a couple chapters. I'm going to continue on with hypothyroidism in the next chapter. So I will see you all a little bit later.